Hello, my name is Dr. Brian Cole, and I'm a professor in the Department of Orthopedics at Rush University Medical Center in Chicago. And the purpose of this educational video is to provide some background about the TROM Adjuster brace. The basic historical premise behind the TROM Adjuster is to marry the postoperative protection of the standard TROM brace to the unloading functionality that we see with a 3-point unloader brace typically used in the osteoarthritic patient. But now we're taking this brace and adding this functionality and applying it to the postoperative environment. The basic indications for this brace is to utilize it postoperatively following procedures of the tibial-femoral joint that would include meniscal repair, meniscal allograft transplantation, osteochondral grafting, whether it be autografts or allografts, microfracture or marrow stimulation procedures, autologous condylocin implantation, distal femoral or high tibia osteotomies. These are basically unicompartmental procedures of the tibial-femoral joint that all have the same things in common. They require an early postoperative period of protection, but they would all benefit from early loading based upon the biophysiology of that healing environment. To many of you, this brace may look very familiar. It's a standard TROM brace, but it has that added functionality of the ability to unload. So I think about this brace postoperatively just like I used a TROM, and I keep these patients maybe initially in extension. So they may be locked in extension, but I can also control their degree of extension and flexion for the time periods that we begin to unlock the brace. So the brace may remain locked, and then at their first post-op visit I may unlock it. But at this point it's in its neutral loaded position. It's functioning just like a TROM brace. Then at the 3 to 4 week mark, again depending on the surgical procedure, I want to start letting that patient progressively load the compartment to start to accrue the biologic benefits of that. How do I do it? I actually will start dialing in a degree of unloading or offloading, if you will, of the involved compartment. So if I have a medial procedure, the brace would be worn such that the pad would be situated on the lateral side of the knee and essentially increase the pressure on the lateral side of the knee just to the point that the patient begins to have any degree of intolerance to it. So I'd like to maximize the unloading ability to patient tolerance. So what we're really trying to do is garner the biomechanical advantages that a 3-point unloader brace would provide, and again marry that to the standard protection phase that usually occurs in the first 0 to 8 weeks. So it allows us to promote early mobilization of the patient at the same time, just because we have that 3-point unloading function that really has an abundance of literature to support its application, and we just apply it to the early postoperative environment. That's really where the novel aspect of this brace comes in, because we have traditionally thought of unloading as a separate principle from postoperative protection. Now we're basically marrying those two concepts.